Well, many of us are happy that the warmer weather is finally here, but that also means that tick season is upon us. Toronto Public Health warning that this season is likely to be worse than previous years. Toronto Public Health's annual tick surveillance program has begun when staff comb through tall grass and wooded areas in places like Morningside Park to determine the number and locations of black-legged ticks. And every year, it gets worse.
Generally, we have observed expanding populations in the city of black-legged ticks.
The health department attributes the steady rise in numbers to climate change, but along with the increase comes a higher risk for Lyme disease, a long-term debilitating illness.
Once we collect ticks from our tick dragging efforts, we'll send them off to the National Microbiology Lab in Winnipeg, and the lab will actually confirm identification that they're indeed black-legged ticks, and they'll test them for the bacteria that causes Lyme disease.
The average size of a tick can range from a poppy seed to a pea, depending on its age and if it's fed. An infected tick would need to be attached to your body for 24 hours or longer before it can transmit the disease.
The overall risk of acquiring Lyme disease in Toronto is still considered relatively low, but it is increased if you're doing activities in wooded and bushy areas in eastern parts of Toronto, such as around Rouge Valley.
With the long weekend approaching, TPH is again reminding you about the ways to stay safe. Some of those include using insect repellent with DEET or a cardigan, wearing long pants and long sleeves, checking your entire body after activities in wooded areas, and showering when returning indoors. Children and pets should be checked too, and if you do find any,
you want to use tweezers to pull straight up and remove the tick. You don't want to twist it. You don't want to try to remove it with your fingers.
If you're concerned about possible infection, contact your physician immediately. Early symptoms of Lyme disease include a rash, sometimes shaped like a bullseye, muscle and joint aches, and swollen lymph nodes. More information about Lyme disease and detailed maps of where black-legged ticks have been spotted in Toronto can be found on the Public Health website. In Scarborough, Erica Natividad, City News.